Joining us now is Louisiana Congressman and House Minority Whip Steve Scalise. Good morning to you.
Good morning, Ainsley. Good to be with you.
Good morning. Good to have you here. You've exposed a lot of this. You said the tragedy was avoidable. What's the latest today?
Well, Ainsley, we're still trying to get more information, but look, I mean, 40% of all the nursing home deaths in America came down to 5 states who violated and contradicted the CMS guidelines that were out, that were very clear, that told states how to properly handle nursing home patients who are COVID positive. And look, most of those states, 45 of those states, followed the guidelines, Republican and Democrat governors alike. But 5 states, for whatever reason, chose to go a different direction, a dangerous and a deadly direction, that ended up killing thousands of nursing home patients unnecessarily. We've been calling for answers. Why did they give those orders? Why did they go against the safety guidelines that were issued from CMS? And why won't they give us all the disclosure of the patient information that they were giving? And then all of a sudden, when we started discovering this, they clammed up and they're not letting the public see what these numbers really are.
What is their excuse? What's the reason, though? 5 states, at least, when we were told that the elderly were most at risk, people with underlying health conditions.
Yeah, we knew this back in March. CMS was issuing guidelines saying, look, if you're a nursing home, let's say you send a patient to the hospital and they get tested positive, you can't bring them back into the hospital unless you have an ability to isolate them and properly take care of them. And look, 80% of the nursing homes in America got this right. 45 of the states in this country got this right. But 5 states decided they're going to do their own thing, and they forced the nursing homes to take back the patients. In fact, in New York, look, the governor issued an order. He prohibited the nursing homes from even testing COVID positive patients. He said, you can't even test them. You have to take them back, even if you don't have the ability to isolate them. And Ainsley, this turned out to be a death sentence for thousands of seniors in each of these states' nursing homes. It was heartbreaking to see it happen. I've asked the governors to come testify and explain why they did this, and also to give us the data that they have. They just stopped reporting it to the public.
Will there be lawsuits?
Oh, I have no doubt. I've heard from so many families throughout this in these last few weeks as we've been exposing this. I've heard from families in so many of these states who appreciate that at least somebody's looking into it, but they're sharing heartbreaking stories. I mean, just heartbreaking stories of their loved ones dying in the nursing homes, spreading this to other seniors in the nursing homes at the worst place you could spread COVID. Over 40% of all COVID deaths in America happened in nursing homes. That represents less than 1% of our country's population, over 40% of the deaths, and so many of these deaths should not have happened.
Congressman, thank you so much for what you're doing, for giving those folks who died a voice. You're welcome.